Okay, this is chapter 3 we're talking about cultural considerations. Um, we're having to look at the patient-centered nursing process, the approach. We are going to know the key points, the objectives, the terminology, and really understand and be empathetic to people's different cultural considerations. We're going to, in this chapter, go over the ethnomedicine, and which is the study of the ways of the people of the different cultures, um, consider how they treat their health and illness, traditional healers, which may include priests, priestess, herbalists, midwives. You're talking about so many different things that different cultures believe. And I could go on and on about it, but we're going to talk about just things that are focused on here. And with the ethnomedicine, it sometimes refers as a folk medicine or a traditional medicine, is a focus of within the medical anthropology, and the examines the ways that people in different cultures conceptualize the health and illness. And in many non-Western cultures, there's a belief that illness is spiritually based rather than biologically based, meaning whether illness is brought on by sin or, say, for instance, if you have a disease, it's brought on by, caused by spirit possession, especially with mental illness. So there's so many avenues that we could go into and discuss how different foods they'll eat after deliveries, different things that they do with the placenta. There's so many on and on we could go into. And so they even may use astrology, magic, rituals, indigenous medicine corresponds with all these things. Now, ethnopharmacology is a subdivision of the ethnomedicine and focuses on the use of herbs, powders, teas, animal products as a healing remedy. These traditional health practices can have neutral, beneficial, or deleterious effects on a patient's health. As well, and everyone knows how our mind's a powerful thing. And when we talked about placebo, sometimes we have to look and respect how they heal, because with their ethnic groups, you cannot change their beliefs. Say, for instance, a person that is Jehovah's Witness, they will not take blood transfusions. They'll use water, or if they go ahead of time, they'll basically, it's not called recycle, it's basically recycling their blood. And they will, on the last resort, do that. But it is in their belief system, and you don't try to talk them out of it, because it's not going to, it's not your job, and it's against our standard of practice. So remember that. Now, your culture, It's based on learned beliefs and behaviors in a shared group of people. Culture is not a biological inherited belief. Um, the concept of transcultural nursing was formalized by Madeline Leninger, a nurse anthropologist. A challenge for nurses worldwide is the degree of cultural diversity owing to the migration of the global movement. Now, the patients that may not reveal the pertinent information, assuming that such things as herbs or teas are natural substances, therefore are not drugs, so they may not be relevant in their eyes, so they may be reluctant to share this information with a conventional Western health care practitioner. But you will see that many herbs will counteract or may even have contraindications with other medications. Now, a transcultural assessment model, you'll see in the next slide, is developed by Geiger and David Heiser in 1998. It assumes that cultures have six um, phenomena, which is communication, space, social organization, time, environmental control, and biological variations. Now we have the accumulation in the process of the group adjust to living within a dominant culture, while at the same time maintaining the original identity. Complementary health practices combine traditional beliefs and mainstream health practices. When a dominant group adopts health practices for a non-dominant group, they are called alternative health practices. Now, as we were saying with the transcultural assessment, it is a communication occurs verbally and non-verbally. A nurse must be alerted to the different types of communication styles among the patients that provide culturally competent care. As you can see in this slide, just go over that and study it. And remember, eye contact and social distance, just basically not getting into a personal space. And then just respect is a key thing in many, especially Middle Eastern cultures. And so be respectful to that. Communication with the occurs verbally and non-verbally. Nurses must be alert to different types of communication styles. Be aware of your body language. Use translators whenever possible. Do not assume that patient's understanding when the patient is being polite or nodding. All cultures have prescribed forms for greetings. Make sure you utilize the language line, and if they're right on that fence and they are understanding more than they um, um, speak it, still utilize the language line in legal documents. And now something with a casual setting, if the husband is in there that speaks English or the family member, you can still utilize, there's so many apps, you can utilize Google Translate, and that comes into play. It's very handy. Okay, as we said, this is basically going over, and I want you to read it, um, about the respect for space. Um, this is the um, families and the basic social units, and how um, each, like the male role model and the head of the household, and respecting that, um, and then even in some religions. So if you expect abuse or anything like that, wait till that, you have privacy, and you want to make sure, if you suspect anything like that, have privacy and talk to them alone, just to verify it. Um, Time perception and the space of the cultural situation. Cultural is the primary, presence oriented. Others are past oriented. The future or future oriented. So you have just a big diversity, especially if you go out of this region. Um, you would be surprised the different cultures I saw uh, in the city, or even in Galveston when I worked at UTMB. Now, we have the environmental control. Um, Read over that. And the nursing process with assessment, planning, nursing interventions. Cultural considerations in the nursing process. Remember, with your patient teaching, involve the family, the head of the household, in the teaching about the prescriptive therapies, and evaluate the understanding and the outcomes. Always document. Very important to document when you're dealing with this, so you won't have any repercussions, and that you have been non-biased. Now, here are some study questions. I want y'all to look that over. Now, if y'all have any questions, um, with the human migration around the world, you're going to see a lot more diversity than over a long period of time. There's so many a variety of genetic markers to study, the pharmacological genetics. So just be respectful of that. All right. All right. Thank you.